Hello, my name is Kevin. This is going to be a recording of the teaching plan template for nursing class 352. I will be teaching about hospice and palliative care for the families of the terminally ill. I am a registered nurse. The targeted learners are the families of the terminally ill patients. The setting would be preferably a healthcare setting or a hospital or patient's room. The purpose of this teaching plan is to provide families of terminally ill patients with the information necessary on the choice of deciding with hospice and palliative care. The overall goal for this teaching plan is the patient's family will be able to state 3 reasons for hospice and palliative care after the teaching lesson. The objectives. Following a 45-minute teaching session, the family will be able to 1. Identify the definition and difference of hospice and palliative care. In this outline, there are 2 differences between hospice and palliative care. For hospice care, it's with a diagnosis of or prognosis of less than 6 months, when no curative option is available, and the professionals are there to make the patient as comfortable as possible. Palliative care, it can be performed on non-terminal patients. It can be included in hospice care. Someone can receive palliative care at any time or any stage of the illness. The method of instruction, preferably for this, would be a lecture to the family. It would take about 5 minutes, and resources I would use is a brochure, dictionary, and any online websites. The method of evaluation would be question and answer. For this topic, it's very sensitive, so I don't think a pre and post test may be appropriate for it. Objective number 2, following a 45-minute teaching session, the family will be able to verbalize hospice team members and roles. There are many members in the hospice team and palliative team. In the objective, I would list a hospice team member and their roles, such as doctors, nurses, social workers, counselors, dietitians, home health aides, clergy, chaplain, volunteers, therapists. This would be also a lecture as a method of instruction. It'd take about 5 minutes. Resources may be such as a brochure of the agencies for the hospice that are going to be provided and handouts. It would also be evaluated using question and answer. Objective number 3, the family will be able to review the common documents used in the end-of-life care and be able to verbalize what each document is. For the content, I would provide the definition of an advance directive, the definition and a form for the pulse or physician's orders for life-sustaining measures, and options within the form, such as full care, comfort care, limited care, the definition of a do not resuscitate order, also the definition of a durable power or medical power of attorney for healthcare, and then also the definition of a living will. This would be provided as a lecture. It can also be provided as a group discussion. It would take about 5 minutes. Resources would be a physician that would be able to explain exactly what options and will be able to sign the post or any other form that is necessary. Handouts would also have the advanced directive form. We can have an example of a living will or durable power of attorney, and then also a pulsed form. The method of evaluation would be question and answer. For objective number 4, the family will be able to identify 3 reasons for hospice and palliative care after the 45-minute teaching lesson. The content included will be the criteria for hospice and palliative care, which includes a doctor's referral and a prognosis of 6 months or less to live. It also includes acceptance of hospice and only hospice care. And the second criteria will be eligibility, including insurance, with that being Medicare, Medicaid, and also, to repeat, the prognosis of less than 6 months. Then some common diagnoses for hospice, such as failure to thrive, any frequent hospitalizations, any weakness that's progressive. This would be provided as a lecture, be about 5 minutes. I would include handouts and a whiteboard. There would be a pre and post test as a method of evaluation to determine their knowledge. Objective number 5, the family will be able to describe the care provided by hospice and palliative care. Content included would be physical care provided at end of life, such as activities of daily living, such as getting up out of bed, changing briefs, taking them to the restroom, feeding if need be. And then also the content will include goals of the care, such as providing comfort and supportive care during the dying process, improve the quality of the patient's remaining life, help ensure a dignified death, and also provide emotional support to the family. Provided as a lecture, about 5 minutes. Handouts can be included, and then method evaluation would be question and answer. Objective number 6, describe common symptoms associated with end of life or imminent death. The content included would be physical manifestations at end of life, including all the body systems, sensory, decreased sensory to stimuli, cardiovascular. Their pulse may be either elevated or depressed, respiratory. More commonly at the end of life, there would be chine stokes or death rattles, also known as urinary, maybe decreased urination, decreased production of urine, gastrointestinal. They can either be incontinent or won't be producing enough or a lot of stools. Musculoskeletal, they'll be weak, won't want to get out of bed. Also contribute to the failure to thrive. Integumentary, maybe dehydrated, skin ulcers, skin breakdown. This would be provided as a group discussion with about 5 minutes, and it'd be included for the resources would be a table or a whiteboard. Method evaluation would be question and answer. For objective number 7, the family will be able to identify the stages of grief which are going to be prominent. Content includes a Kubler-Ross model of grief, including the 5, I guess you would say steps, but they can be in any order. It would be denial, anger, bargaining, depression, and acceptance. This will be provided as a lecture, be about 5 minutes. It could be included or resources included, maybe a diagram, a table, or a whiteboard. Method evaluation may be question and answer. And number 8, and most importantly, the objective, the family will be able to express any concerns about hospice and palliative care. Content included may be summarizing common concerns and misconceptions about hospice. The main misconception with hospice and palliative care is the family will, or the patient will die, and it's for them to die. There's not always the end. They may be on hospice and then may be reevaluated and be taken off hospice. And then also the second portion of the content included would be exploring their feelings about hospice and be able to answer any of their questions. This will be taught as a group discussion, be about 10 minutes more because it's more sensitive, and then we would like them to provide their emotional feedback. It can be as a whiteboard for the resources, or it can just be verbalization and talking to them, having a nurse there present to answer any common concerns, and then method evaluation would be question and answer. That will be the end of the teaching plan, and hopefully the family will be able to state 3 reasons for hospice and palliative care after this teaching lesson.